start my contribution, I would say that my main focus in this dialogue is to actually engage people around us or the audience and convince us to make sure that we are part of the advocacy, and also to share with you some of the resources that we could have access to in our system. I will say that I have left Ghana for some time, but I still work along the issues of disability across the globe. And I know there are so many resources around in terms of COVID and disability. And I want to also check from the audience, especially how people are very much abreast with time. And I will say that I'm coming to this discussion with the lens of advocacy and analyzing policy, in terms of analyzing policy from the up to the down, making a policy to connect to practice on the ground. So I will not be so much, what's the name, so much professional, but I'll be very much critical, because to me, this will be a little bit of discussion to us, especially we want to empower our parents or our students, anybody on this platform after living here, to have access to what we need to do or what has to be done as individuals with disabilities. So as you already said, we all know that when COVID came, it struck us in a very huge sense that nobody has the answer. Nobody has the idea of solving the problem. And very interestingly, the answers were not that perfect to us, but the reality is nobody actually thought of a child or the girl child with disability in all the solutions. We realized that there were a lot of, or a plethora of research documented here and there, and we were trying to solve the answer, solve the questions with the same answers. But it's like we can feel it ourselves that it has disproportionately and severely impacted our students with disabilities who are already experiencing social and educational disadvantages. And you and I will definitely understand that for a child with disability, um, it is not only the remote learning. That is not the main focus. For instance, remote or homeschool is not only requires access to adequate ICT resources and internet, or availability of books and other learning materials, but it's also the access to specific assistive devices or special education curriculums that allow for a continuous education at home. And you and I could see that at that time, parents immediately just became tutors or lecturers or teachers at home, and we were all confused. The policymaker or the implementer never has the child of disability in mind. So for me, I know there is this stigma already as we have as our culture, but the question is, at that point in time, and as we are still trying to solve the problem, does the policy actually cover the child with disability who experience violence, trauma, and experiences when confronted by a mask, the mask that we are wearing now? Is that child with hearing loss who depends on lip reading at a time when everyone's mouth are covered by masks? Presently, we are still in that situation. We are still using the mask. But the question again is, that there's a person who has a mental health condition, depression, anxiety, OCD, all those ones, you and I can talk about some of the disabilities that we don't even have names for on our ground or in terms of Ghana, where we are talking about some of the disabilities, we don't have names for them. Do we remember even the major stressor, like, that time when the COVID struck, there was this fear of medical rushing that target people with disabilities from getting life-saving treatment when there is a shortage of hospital supplies. Like that time, we were all thinking about ourselves in isolation. Like those things were not thought about. Here we are now, and we are still using a mask. We are still sidelining people in the solutions that we have created. That is a huge thing for a child with disability in our system. Both, I mean, I won't say only Ghana. I'm still fighting the same cause in the US system because those things were not thought about immediately while the solution is being brought. But my take, what I want to challenge us here now, for instance, in the Ghanaian system, how many of us know the money or the fund that the Ghana government has received to solve COVID problem? Does anybody know here?
I think, well, maybe I shouldn't be answering, but I think it was like 2 billion at the start. They took a loan of 2 billion or something from USAID.
Exactly. From USAID, exactly. That's what I found.
Yeah.
Exactly, from online. That's what I found. But the question for me is how much is allocated for a child with disabilities education? That child who has everything around. Well, as I talk about curriculum, as I talk about what assistive devices and everybody, you know how we are trying to solve the problem with the same answer, with the same answer. While disability issues are so much different. But what I would say the audience need to know from the policy perspective, I would like to share some of the resources that I manage here in our organization, or things that are happening practically. I would like to challenge everybody on this platform that we have to target this with some policy mind, even though if you are not if you're not policy inclined, there are so many petty things that we have to do by just asking questions, asking those constructive questions in the media. We know that right now we are very much proactive on Facebook, Twitter, Instagram, everything. But we have to be very much proactive to really challenge our system. Policy-wise, there should be pragmatic actions, which should be laid down based on our target, based on the fact that we are asking questions. So for instance, in the US or in Vermont specifically, there is this need to work on some of the funds. So for instance, we have what we call the school district fund, or what we call the grant from Care Arts. Presently, we are managing about 285 million purposely for schools, just for schools. And that is part of the American Recovery Act. And the question still remains, if this money, if we should have the same, like this 2 million or whatever thousand we were allocated for in Ghana, how are we going to know? How are we going to really assess the money? Those are some of the things that I would throw to GIG and other organizations that are working on the ground in terms of education, for instance, to really have those type of questions. Another resource that we have here is the RISE Fund. The RISE Fund actually is the fund that we manage, which is Resilience and Independence in the State of Emergency. That is the full name. And it's from the Care Arts Grant, and it's purposely for COVID fund. It came when the COVID came. And this fund, every student is supposed to apply to get 2,500 US dollars. Something like this should be monitored, or should be organized, or should be established in our system, because we have some funds to solve problems. So of education could be the resource for you. I will say that you have to pay attention to the things in the media. That is my second point. Pay attention to what is happening in the media, because the media is actually carrying the message across and making sure that things are working. So that is why you have to be in line with what is happening in the media and also pick it up from there. I will also encourage us that this is very much practical. we have to, as much as we parents are now educators in the home, I would like to challenge us, or even practically those that are helping their younger ones in the house, to get to know the learning platforms of our children now. Because one thing that I know along the line is, in our Ghanaian system, when we dress up the child and we send the child to school, that is it. The child is for the teacher, the child is for the school for that period of from 8 to 12 or 2 o'clock or whatever time. Interestingly, now there is a paradigm shift. The table is turned around, definitely. This system that we are working on, you as a parent is in the same class with your child. That is one thing that I have noticed, because my son is in 6th grade. I am still in 6th grade with my child. Why? Because I need to know the platform that she's using. We have a lot of platforms there. I'll put some of them in the chat box, that when you click on them, you can have access to them and see, and I mean, maneuver things yourself. Because the major one that is being used purposely for education in our system here, which I think is also very much accessible in the Ghanaian system, is the Google Meet. The Google Meet platform goes with the Zoom, but it must be synchronized. In other words, if they don't do it like that, the child cannot understand. So you as a parent has to be what? Very much aware of the system and try to help this child. But the question still comes back to the fact that, does that child with disability who has autism, who has no idea about how to maneuver on Google Meet, actually has uh, uh, access to this platform? That is the question that we have to ask. And if there is no access, that is why you have to fight as an individual parent to get that funding from the government, through the organizations who are fighting for this cause. I don't know how much we are targeting our NGOs on the ground. I'm talking to parents that they are fighting for this cause. Some might have funding. When we link up to GFD, that is the greater umbrella that we all talk about, that is the Ghana Federation of Disabled. What are they doing practically on the ground for people or children with disabilities on the ground? That is the focus that we have to take from aspiring, and actually connecting it to the faith that we have. That is holding me up to now. If I should say, the faith-based focus that we have to apply to COVID and forward ever, or COVID and above, it will sound a little bit weird to some of us, but I have to encourage you that holding on to your faith in terms of things that we hold on to, whether you are Christian, a Muslim, or whatever faith you have, I think carry us through the COVID very successfully. You and I, like I'm talking with the Ghanaian mind now, but because the fact that we believe and we pray and we still know that COVID is around, it is killing people. We are not the best. We are not better than those actually who have actually left us. But the reality is we have held on to some faith and we keep on going. So ideally, I just want to revamp that spirit in us in terms of what? Holding to the faith that we are holding on before COVID struck. Because without that faith, you will be exhausted. It is really exhausting, because on the ground on which I am, had it not because of my Christian values that I apply to the COVID news around me, I think by this time I would have gone, because it's really devastating. And especially when you assign it to the child with disability on the ground, of sufferings and everything that a child is going through, you will say this cannot be done anymore. COVID has taken over. But I want to end it that when you get your information, don't be selfish. When you get information, especially as I'm throwing it out to everybody, like do research, ask for questions, and make some move in terms of advocacy. When you find that GIJ are getting some support for girls, when you get that information, it's very typical of us Ghanaians to be so selfish. Or when you get the fact that this is the resource which is beneficiary to other people, don't close your mouth on it. Share the news. let people know about what is in the system, because the Ghanaian system is such that I am the only one for this, or I should be the only one entitled to this. This cannot help us. So I will stop here and um, make sure that you ask the questions that will help us. It's a discussion. To me, it is not a delivery. We need to brainstorm around our children with disabilities and find a solution. So thank you very much, Elizabeth. And I'll hand over to the next person. Thank you.
Okay. Thank you very much, Sefakor. Thank you so much. It's been a while since I've seen you, and thank you very much for that presentation. And I hope everybody will take away this one thing. This is the thing that I took away. Hold on to your faith during times of struggle. I think a lot of people have become depressed or really down as a result of our limited in face-to-face interaction with each other. And if you don't have your faith to hold on to, definitely you might break down a lot. And I'm glad you're holding on to your faith. But I have a few follow-up questions that I have for you. We want this to be a very interactive discussion, not just me and you talking, because I could just pick up the phone and call you and we could have this conversation. But as a parent who has a disability yourself, how are you supporting your mainstream child and other students in school?
So when you ask, as much as I love sharing my personal stories, I realize that my story, it's a bit easy to understand for some people at the same time, because it's like when you connect that to children on the ground today, it's so hard to believe. That is the reality on the ground. It's so hard to believe. So in my capacity, for instance, right now, I'm mentoring some students from Ghana, Kenyan, and Uganda, who are actually under our organization, the Enlighten and Empower People with Disabilities in Africa, getting through those processes that you and I have passed through easily. The word is easily because somebody pushed us to get to this level. And that is, yes, because that is another thing that I realized that most of our children don't have on the ground. And I have some of those people on this platform, that the fact that you and I can go to school, can read, and understand that you can apply for these resources here and there, and can even talk to some people, because at times some of us just need to have a push, a little bit of a push, or to talk to somebody to direct us. So practically, I have this mentorship program, mentoring these young ones to come up, to be proud of their disability first, because that is one thing that I realize is missing. It's a big missing piece in our system for ownership of the disability that you have. Because I always tell them that if you lose your identity as a person with disability, it might be physical or visible or invisible. And mind you, you and I, we don't even talk about invisible disabilities in Ghana. When somebody has epilepsy, sickle cell, whatever, we don't even talk about it. It's not disability. And the people themselves don't even know. So that is a process that I'm leading them through now, to actually know themselves, own the disability, and be proud, what we call in the American system, like disability pride. Be proud of who you are. Yes. And if you have that pride, then you can project yourself well. Because one thing is, if you lose your identity, anybody in the system will throw any garbage they have on you. And that garbage could be, you have a Down syndrome, you have autism, you have this and this, you can't do this and that. And the moment they assimilate that and internalize it, it becomes huge. So making sure that they come out from that shadows is the first process. After they know themselves and know their identity, they can actually also move forward to advocate for themselves in terms of self-advocacy, which you and I have done so many times till we got here. After self-advocacy, then they lead to what? Talking about systemic changes, making systemic advocacy to make changes here. That's why I'm actually challenging the people on this platform that this should not be a 9-day wonder for us. We should have a process that after here, what next? I'm challenging everybody. And I know every Ghanaian who is on this platform right now, except one name that I don't know, Christian Menu. Apart from that, I know everybody. And I will tax everybody after some time, especially Elizabeth, should to see the holding our government accountable, because we need to do that. Regina, we need to do that and hold our government accountable to make sure that things are working for us. Because practically, we are doing our work as individuals. Thank you.
Thank you. The next question that I have is like, you have experience working in Ghana and in the US, right? And you know the stigma is so real in Ghana. In the US, I honestly at times don't feel like I have any limitation or anything, because I maneuver my everyday life as if no one's staring at me or there's nothing wrong. But you being in Ghana and me being in Ghana, I know that every day that I step outside of my house, my difference is in my face, right? So how do you think we as Ghanaians can get over that stigma, that mindset of stigmatization on people with disabilities?
Elizabeth, thank you for that. This is a very clear picture of how far we have gone. That's our culture actually stigmatizes us a lot. But the reality is America has also struggled to that level. They have gone through that system, and that was when they had the disability rights movement fighting for their rights. And up to now, we are still fighting, because right now I work with all the students with disabilities across Vermont State in school system. And that alone is huge. And interestingly, this question of stigma is still here. Students on IEP are still marginalized in a way that you and I might at times even not believe. But coming back to our ground, I just want to say that it is time that we educate our people very well. I think we talk about it so much so that we don't practicalize it. Education of the masses, it's very much needed, because we don't know what it entails to be a person with disability in Ghana. As I said already, we don't even have names for some of the disabilities in Ghana. And those people are dying, I mean, gradually. People with mental health, you and I know how we change them, how they are on the street. It is our duty as organizations to really go extra mile to put things practical on the ground, to align policy to what practices on the ground, as I always say. So I will say that it calls for education. I would say that we have all the policies on the ground, on paper, that we are always talking about at UN level every day and night, that we are doing this and this and this. Yeah, but I think the tax is on us, you and I, as individual organizations or founders of organizations of people with disabilities. We need to take advocacy to the next level so that we can make sure that this is done. And that's one thing that I know right now in COVID world is going on, is using the media a lot. And that's, so the stigma is always here. It's everywhere. A typical example is I'm right now fighting the system with a program, not a program, with a school whose IEP students are kept in a place where the trash can is kept. And that is huge in American system. Yes, you will believe, no, you can't believe that. So that is how the level is so different that, yes, they have fought, but I will say very positively that the system is working. That is the biggest difference. The system is working for America because when you know the issue, you talk about it, you advocate for it, you are going to solve the problem. And they are ready to change this, the thing. That is it. The mindset, they are open-minded always. It's left to you to point out that this is not good. And as some of us always advocate, we will talk about it. Yes, we need to work out our system so that what we hold our government or leadership accountable from the ground to the top, and we can make it.
I have one last question, but I want to encourage everybody else, if you have a question, do use the hand raise button or teacher, or put your question in the chat box. But my last question is, you just talked about affecting systemic change. As a resource person for GES, how are you currently right now making sure that GES makes education inclusive for students here in Ghana?
Correction, please.
Oh.
I was resource person for GES for the past, let me
But you're such an
from
influencer. I'm sure you're still influencing things.
So let me clear the air. I have no control over the system anymore. I don't have anything to do with GES presently, but I still work as a person, as a person, as an advocate. I still advocate across the globe, provided that I know the issues around. That is why I was even initially asking, how much do we know on this platform that the Ghana government has to solve COVID problem? Something like that. I really want to dive into it and see how best the people with disabilities with the Ministry of Education can really work together. But that calls for a huge money, how do you call it, plan, because you know how you, when you want to have some of the grants or access to some of the funding, it's like there is this blockade that only these people can get it because your organization is small, or because of your organization is not part of this group, in the system, the Ghanaian system. So I'm leaving that to you, how you will definitely work out things with MasterCard. Yes, with MasterCard. And because presently I don't work with Ghana Education Service. Yes, that is, but I fight for it, for the systemic issues individually with our organization, EEPD Africa. Yeah, thank you.
You're welcome. Regina has her hand up, and then I also saw Augustine with his hand up. Please unmute yourself and ask your question. So Regina and then Augustine.
Yeah, Sofako and Elizabeth. I just had the question for Elizabeth asking how GES making headways as to really including learners with disability in the regular school system. Well, I think there are some things that are being done now. For one, there's a lot of training for teachers in the regular school on how to teach individuals with special needs in their classrooms, because many of them, at the moment, we are working with those with mild to moderate disabilities. We're working with them to be included in the regular school system. And so we're doing a lot of training for teachers. That's one. There are also some assistive devices that are being given freely to some of these learners. We have those with some residual hearing having hearing aids. We have a number of things that are being given. Well, I can say that it's not much, but we are doing something. I'm in the Western region. I'm in charge of special education here. And for the past 3 to 4 years, we've had a lot of children with disabilities being included in the regular school system. And we have resource teachers. Some are cluster-based. When I say cluster-based, I hope you get it. Where there are about 2 or 3 or 4 schools on one compound. We have cluster-based resource teachers. We have circuit-based resource teachers. We have, in some places, school-based resource teachers who are helping the teachers to really assist the learners with special needs. So for now, these are some of the things GS is trying to do. We have a long way to go, but like I say, slow motion is better than no motion. So we are on it.
Definitely, slow motion is better than no motion. Sefakor, do you have a comment? to add?
Yeah, Regina, thank you for sharing. Actually, Regina is one of my allies. We were in education. Oh, we were mates, classmates from Mount Mary Training College. So, and we entered the special ed um, together. So thank you, Regina. It's good to know some things like that are happening. Now you are talking in capacity of GES representative. And for me, the target, I just want to know what actually was done during the during the COVID time. Like these things have been there, but I just want to know, as you know, we have started, but were we able to tackle the child with disability at that time that COVID struck? As I've just explained, like here, everything was done before we came back and we started talking. We actually need to talk that where are our children, what, and those stuff, you know? So right now, what was the real solution for people with disabilities during COVID in Ghana in terms of from GES?
I, for one, have not heard anything. There's been speeches after speeches about what they're doing to prepare students and educators for
Yes.
going back to school, but I haven't really heard about anything for inclusive schools or kids with special needs.
Okay.
Regina, if you have something to add, please go ahead.
Well, generally, there was a lot of trainings and sensitization on COVID protocols for all schools, or everyone, whether it's a special school or everyone was involved. There was a lot, and PPEs have been distributed to schools, a lot of it. All schools in general, PPEs, a lot of PPEs. One thing that I would like to say as regards specific assistance given to learners with special needs will be, well, for those with intellectual and developmental challenges, they were in school, in the house when schools were. It was only the school for the deaf, they were still, and the blind, they were still in school. And so for instance, for the school for the deaf, we had to add, we had to write first to request for face shield because they were only providing them with a mask. Mm-hmm. And of course, it would be very difficult for them to communicate with the children with their mask on because the facial expression also counts in their communication a lot. Yeah. So we had to request for face masks, face shields. So that was given. In fact, just a few days ago, I was in one school and they claimed that their face shields are finished. So we are working on getting them. So that is one specific assistance that was given to schools that have children with special needs. But generally speaking, every school was, have been and still, they're still getting a lot of equipment and things as far as the PPEs are concerned.
Thank you, Regina. And I think because it is tackled along with, we are tackling it in silos. As you said, you are in Western region, and I thank you so much that you are doing something specific. In this case, we will tax ourselves in case of anything that you can do, because realistically, as I cite the example being in Vermont here, we even had workshop for parents with children with
I'll not cut you. I have had that. In fact, I just spoke to a parents association chairman just a few minutes before I got on board on the Zoom meeting, because I'm planning to have them for that school. They don't have a parent self group. I am planning to have one for them. For other two schools during the COVID, I had several trainings for the parents. Even there were times when they even had to spend 3 days in the school. We had to accommodate them, and it was very nice. Another one that I didn't do that, so that's what I'm planning to do now. I just spoke to the Parents Association chairman, so we are working on it. Well, like you said, it could be that it's specific to Western region, But I'm hoping that my colleagues in other regions are also
so
doing
much.
something.
So thank you very much, Regina and Sefakor. Thank you very much. But in the interest of time, our next speaker has another commitment. So let's please bring her on, and then we could continue the discussion afterwards. All right. My next speaker is Blessing Mary Ochedo. She's a mentee of mine who I've yet to meet. But when I read her profile, I was so impressed by her, and I'm privileged to be mentoring this young woman who doesn't really need much of my mentorship because she's a superstar on her own. Blessing is a practicing pharmacist and a published writer and a human rights advocate with Platinum Interventions Care Initiative. Blessing is presently a One Young World Ambassador and a United Nations Steering Committee member on Vision 25. Blessing, you're up next. Please speak. And it's a pleasure to meet you.
Hello, everyone. Thank you so much for the opportunity. I will be speaking mostly about the effect of COVID-19 on
Is it possible for you
education.
to come on video so we see you?
No, it's going to affect my network connectivity.
No problem. Please go ahead.
Okay, thank you. So I'm going to be speaking about the effect of the COVID pandemic on the educational sector, especially for students with disabilities. I am the executive director of Platinum Intervention Care Initiative. Is a non-profit that, amongst other things, advocates for the rights of persons with disabilities and empowers them. And so, as COVID-19 raged around the world and we experienced uncharted waters, the educational sector took a big hit. Schools were summarily put on hold. People had to stay at home, observe social distancing to ensure that the virus was not being spread, because we were not even sure about how the virus was, how it was going to end up and all. And as such, most activities moved online so that people could battle with this new and grave reality. Schools, churches, businesses, everything moved online for those that could, and for those that couldn't, they were all summarily put on hold. And so as this happened, most schools and educational programs also suffered a major setback. Eventually, we were able to create, or around the world, programs were set up to ensure that learning continued for students online. However, this was a privilege only for those who were in developed countries. And this was hardly the new technological programs did not take into cognizance the fact that there were people in developing countries, and even for schools in developing countries, these digital platforms were not inclusive of persons or students with disabilities. And as such, this revealed a major problem for us, that the digital space is mostly non-inclusive of persons with disabilities in general. And so I looked around me and I saw that for most events that I was invited to participate in online, there were very few persons with disabilities. The representation was very low. And I began to understand how this could set up, or this could begin a new, this could become a bigger problem for us in the future, because when persons with disabilities are not allowed to participate in key events that affect them, when their able-bodied counterparts are being taught and they are left behind, we are already creating years of problem ahead of us, where millions and millions of persons with disabilities are totally and completely left behind. And so we began to do a research to understand the impact of the virus and an eventual short lockdown on persons with disabilities. And we found out that most children with disabilities were at home, neglected, even especially women and girls with disabilities were suffering from major major neglect, abandonment, physical and sexual violence in the homes and in the communities, that they were now forced to remain with their abusers right there. And this is why I began to speak up about the need to make the digital space accessible for persons with disabilities, not just for businesses alone, but also to ensure that they could learn on these platforms. And as such, as we're seeking to revolutionize the educational sector in terms of adopting new technological models, we must not forget the millions and millions of persons with disabilities around the world, especially in developing countries, in Africa, and of course, especially women and girls who are even more vulnerable to sexual and physical violence. And so I would recommend that we do the following: develop disability-friendly educational tools, digital tools. In order to achieve an industrial revolution, we must ensure that persons with disabilities can also access and function or are carried along as their able-bodied counterparts. Finally, we must endeavor to build the capacity of the sustainable development goals are achieved within the next few years. We must ensure that persons with disabilities are taken into cognizance, especially in the educational sector and especially in the new and emerging technological platforms. Thank you very much.
Thank you very much, Blessing. How many minutes do you have before you have to go?
Say 5 minutes.
5 minutes. So you spoke, my internet disconnected for a little bit, but I just heard you speaking about how you began to digitize the digital space and make it more accessible for people with special needs during COVID. And I'd like to know a little bit more how you did it.
Okay, so in essence, what I'm doing is I said we're going into rural communities in Nigeria, seeking out persons with disabilities, because the way disability is perceived in Nigeria, especially, it is seen as something to be ashamed of, for especially for families where there is very low education. So these parents are ashamed of their children with disabilities. They do not allow them to participate in public activities. They do not go to school. They do not go to church. They do not attend anything that is social in nature, because they are actually like ashamed of these children. So they send them to the villages to be with their grandparents, or they just lock them up at home. And so we found out that millions and millions of girls with disabilities are being locked up at home, or they are in these rural communities. And so we couldn't find them in the cities. And so we had to go to rural communities to look for them. And then we're able to find some young women and girls that were willing and were ready to participate in ICT training. So what I mean by this is that we pay for their transportation, we pay for their training, we bring them to ICT centers to train them on how to use the computer, basically, how to set up profiles, how to set up accounts on social media, how to interact on social media, how to build business, how to run businesses on social media. In fact, how to use the computer in general, because in realizing that the digital space is not inclusive of most persons with disabilities, it wasn't just about they are not being carried along. It was also about their capacities in the first place. So persons with disabilities, most of them do not have the kind of education that empowers them, especially in my country, Nigeria, that empowers them to use these digital platforms. And so we're actually training them to become very adept at using these platforms so that they can take up spaces, they can build businesses, they can reach a wider audience, and they can also lend their voices to things and policies that affect their lives, whether in the community level or at the national level. So that is what we are doing right now.
This always happens. I start speaking and then I realize that I'm on mute. I was saying thank you very much, Blessing. Does anyone else have any questions for Blessing before she has to hop on more of their engagement?
Thank you. Okay, thank you.
Yeah,
I just want a quick question based on the level at which Blessing has gone with advocacy, being part of Beijing. How I'm trying to connect this with the UN Convention on the Rights of People with Disabilities as Nigeria has ratified. So how is the government involved in solving this practically? Because what you describe right now, we were there in terms of locking children in the house, or I would say we have been there because maybe we are still doing it, but I just want to know how you are doing the advocacy to that level in terms of connecting Nigeria to Beijing. Thank you.
Okay, if I understand what you mean, are you talking about how Nigeria is implementing the United Nations Convention for Persons with Disability, right? Is that what you're talking about?
Yes, especially as you have engaged in this practical way, trying to align policy to practices on the ground.
Okay, so there are many, we have a long way to go, really, because I know that we fought for over, well, people before me, I came and found that they were fighting, and we continue to fight together for the rights, for the Disability Rights Act to be passed to law, and that was eventually done in 2019. And so right now we're working on ensuring that there is even implementation in the first place. So we still have a long way to go in implementing these rights. The thing is, many people with disabilities don't know their rights. The government themselves are clueless. So there is so much that the civil society space is trying to do to bring these, to ensure that all the policies, all the parts of the Disability Rights Act are even brought to the table, discussed, and finding very strategic and effective ways of ensuring that they are implemented. So we are still at that level. There's very little going. There are very few grassroots measures right now, except for very being long lasting. So there are so much we are doing. There's so much the UN is trying to do in ensuring that even in Nigeria, that the rights of persons with disabilities are being respected. And I think one of the clear measures that the United Nations in Nigeria is doing is to the political sphere, trying to empower young girls and women with disabilities to take up spaces, to run for offices, so that they can actually help or fight for and ensuring that these policies in the first place are being understood at the legislative sector of the government. So actually, there's still so much we're doing, and that is why I am almost working alone in ensuring that the digital space is inclusive of persons with disabilities. There is so much to be done, and I do not want to keep waiting for all these bodies to come together to agree before little changes are being done. But well, I am still hopeful, and I know that there is so much that will be done in a few years to come. Thank you.
Thank you too. Elizabeth, you are still muted.
Thank you for that, Sepako. I was saying that I'm very excited to see the next presentation and the next presenter, for Steve, who has been a friend from way back. And we were introduced because of the affiliation and affinity that we both have for girls' education. So Faustine, I hope it's okay that I address you as Faustine. Mrs. Faustina Akosia Ejewa Kofi is the Assistant Registrar for the Human Resources Unit at the University of Mines and Technology in Tapat. She's a gender advocate and consultant. She's a researcher and a policy analyst. She's also the former Municipal Girls Education Officer, GES, and also the former gifted co-facilitator for NYU, my alumnus. Fosti, you're up. Please take the floor.
Thank you, Elizabeth. Hello?
Yeah, we can hear you.
Yeah, we could hear you.
So, thank you, Elizabeth. And thank you
Girls Education Initiative Committee or team for giving me this opportunity to be on this platform. This is my first time to be on, and I'm so grateful. Really, my task was to give my thoughts or experience on support that children have got or have been getting during this COVID period. So I will talk a little about that. Really, when I heard our presentation, I thought it's going to be the form of slide. So I presented something, but all the same, I can speak to that. So there are so many sources of funding for children in school in Ghana. Government had funded or had given support to school children. The challenge is that the supports, wherever they came from, were not targeted specifically at children with disability. There were general supports. So PPEs were provided for schools by government. Before school reopened, there were fumigation exercises in all schools, including special schools. And even when they were at home, governments made sure they got distance learning on TVs and radios. And with this, I see it was a good work that government did. But how many children in Ghana get access to television and radios? Only few, and those who have even TVs in their homes. Were they allowed by their siblings and parents or their relatives to meet the schedules of their subjects or studies? That becomes a challenge. So I see a lot has to be done in supporting children with disability. NGOs also supported, UNICEF provided support, Plant Ghana, International Ghana, and other bodies. But all these bodies, religious bodies, also these educational bodies, but none of them targeted these children with disability. They gave general support. So if there is a school with a population of say 2,000 and only 5 are disability children, they get the same resources. And I think that wasn't the best because children with disability, they have special needs and they have special learning challenges. And in providing resources, I think all these challenges should be taken into consideration. After COVID that the children went to school, there were overcrowding in schools too. There were no additional infrastructures, no provision of chairs and tables or whatever, no expansions in schools, except few. And these children went back to school to meet the same facilities they were in before COVID. How clustered they were in their classes. And I think that isn't the best, and nothing has changed. It's the same issue in even all the special schools. And I think attention must be drawn to this. The textbooks that these children were using during the pre-COVID era are the same textbooks they are using, and no situations have changed. At least these textbooks can be revised to include COVID issues, so that these materials, children can learn from that, linking it to the current situation. And I see that another challenge that is happening is that the teachers in schools are not ready to give special support to disability children. There were no training, special training for them to handle them. So they handle disability children in schools during this COVID period, like they handle other students. Meanwhile, they need special resources. They need special attention, which is not given to them. Disability children need time, more time to learn. They need to learn through projects, project work, research work, which I think they do best in that. How many teachers are even ICT inclined, have ICT skills to assist these children in doing this research? And how many gadgets do they have? Special gadgets. There should have been special gadgets designed to meet the needs of these children because they have different and variety of needs, but nothing was done. So I think the government is doing something, NGOs, philanthropists, and educational leaders are doing something, but that is not the best. In policy-wise, there are a lot of things put in policy, but are they being implemented? No, they are not, which I think is not the best. Having a huge booklet with a lot of issues in without addressing them, it's just a waste of resources. So all policies, all reforms targeted at disability should be put in working. Also, I think that this issue, challenges we are talking about, shouldn't be only on the head of government. All of us must play our roles to ensure whatever means that we can assist disability children, we should do, because they seem not to be happy on this earth. Sometimes, some of them think, how were they created the way they have been created? Why are they being treated the way they are being treated? And that is no fault of theirs. And if one of them were to be your child, are you going to treat the same person, your child, like that? And I think it's even done because in most communities, when they give birth to children like that, they think they are that child is a curse to the family, and they kill that child. So if even a mother can behave that way, can maltreat a disability child, I don't think it will be something new, but that shouldn't be the case. All of us, educational bodies, individuals, whoever, we should put our heads together, plan how best we can assist the structure, educational structure, so that disability children can benefit and perform up to their maximum. Thank you.
Thank you so much, Fosti. I'm sure we all learned a lot. Aisha Mickey has a hand up. Please ask your question, and then I will proceed with my 2 questions that I have. So Aisha, you have the floor. Please unmute yourself and then ask your question.
Sorry. Thank you very much to be part of this forum. I'm a private person. I have an early childhood center, but my specialty is on gender and disability as well. So I've been in the sector for quite a while. I'm coming in from 2 sides. One side is that before schools reopened, I was part of a team that went around to train various education actors at the regional level, who are also supposed to go down and train the district and communities on issues that communities and education actors need to be aware of before reopening. And one of the things that, one of the themes was on pregnancy and the need for girls who are going back to school, for girls who might have stayed at home and gotten pregnant, to be assured that the school environment is open for them to come back to school. And there were also themes on safe school environment, making the school environment safe and safe for all. And there were also themes on psychosocial support for everybody. Psychosocial support for every child and every adult after going through all the trauma of listening to the COVID, it was in the programs on TV and the media around COVID, and how all of us were devastated, even scared to go back into the schools. So all these things targeted everybody, but if you look at the themes were quite relevant to all, both able and non-disabled people. So that is something I wanted to contribute, that there was some effort to educate people about all these things and for them to keep the school safe, to make the school non-bullying environment, non-violent environment, etc., etc. But on top of that, what I see as the biggest gap, as an early childhood provider, I noticed that, of course, government will focus on government schools. But this time around, there was a lot of support also private schools that is from KG upwards. But for those who were, for the private sector that is involved in early childhood, like from the crèches to the nurseries, they were left out because GES, at least where anytime we raise the concerns that why are we not getting support, they say you're not registered under GES, you're under social welfare, so you can't get support. So that for me was quite sudden, especially for the very little ones who needed support around this time but couldn't get it. So all the cost has to come back to private individuals who unfortunately were not getting any form of support from the government and from education specifically. So that is an area that I felt wasn't good. At the moment, for instance, I just had a parent approaching me 2 days ago. She has a child, she suspects to have autism. I've just recommended that we do some assessment to confirm. So this parent is coming in. I'm really open to taking this child on board. This will be my first child with disability that will be taken on board if the facilities can meet the child's need based on the assessment that comes in. But what I've noticed is that all along as I'm thinking through, some extra cost will be required to take care of this child. But I can't get to the government because once again, I'm very sure that I'll get that information that you are not on the GES, you're on the social welfare. And social welfare is already struggling as a unit. So they don't have any resources for that. So if I bring in this child to my school, the burden is going to be on the poor mother and father, in this case, who will struggle to pay for the extra cost of making provision for this child. So that is why I see as a very big gap too, in terms of all that is going on. The government is doing well to involve both private and public, but this particular group of people, young people, are not getting the support that are required. So the burden goes back to the parents. And mostly when a family has a child with disability, as you all know, it goes back to the woman. It just happened that the example I'm citing, I can see both the mother and father interested. So they both took the step to even come and make inquiries and to take on board any advice that I've given them, and we are willing to move forward with it. So that is a big area that I think we need to look at in terms of research and in terms of advocacy that I think I should also bring forward. Thank you very much.
Aisha, thank you very much for your comments.
I have a question for Aisha.
Yeah.
Aisha.
Yeah. Hello, I'm here.
Yeah. Were the teachers in special schools trained differently from the normal schools?
No, so this was, as I said, I was trained as part of a trainer of trainer to go and train the regional level actors. And this training was led by Ghana Girls Education. We have guidance and counseling, where the special education. So it was a big team. And of course, I was a private practitioner, but I happened to be involved. So that was So it was supposed to go down. So as we are going down at the regional level, the actors included special education actors at level. So they would then further go into the district and to the community. So that was how the information was to be passed down.
Yeah, but for your information, there was no training for the teachers in the special schools. Maybe the special educators went for the training, but in most of the schools, in most of the special schools, the teachers there did not get any training. They were trained as part of those in the normal schools. But what I was talking about is giving them special training specifically to address the issues with the disability children. Do you get that?
I get you very, 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 very clearly. Sometimes about what kind of information we are looking at an inclusion. Inclusion is the the direction that we claim to be to be following now as a country. That's the claim. As to whether we are doing our best or not is a different question. So what I've seen of late is an effort that when there are activities, either training or the rest, we all come on board, we all place our hands on the deck, and we'll try to look at the issues from the different dimensions, so that everybody, whether you are in a special school or not, you're also part of it. So for this particular exercise that I'm talking about, the intention was not to train per se, to train teachers per se, but it was an awareness that was going out. Then maybe another group of people would have picked it up. Because the money was coming from, don't think the money didn't come from government of Ghana. It's donor money, and donor money have there's a limit to which donor money is. So it was for an awareness raising that, hey, community, go back to school. We are making your environment very suitable for you. We will provide all the PPEs. Our environment will even be better off than what you have at home, because at home the kids were left around and they were roaming everywhere. So when you go back to school, the school environment is much safer for you to go. So go back to school. So it was more of an awareness raising. So for me, for instance, even after the training, I was not asked to go and train any teacher, but because of what I do, my responsibility was to pass it on to my parents as well and to the community in which I operate. So that was how far I could go. I couldn't go around organizing for these teachers, but the ones that were involved, the coordinators from the district and the regional level, they were supposed to pass on the information further down. If they had to be through in service, they should have gone down. But maybe it was just unfortunate that they didn't get it as planned, maybe due to resources. And I equally know that some of the regions couldn't be because those districts couldn't secure funding to push it down. So yeah.
Thank you very much.
Yeah, Elizabeth, can I make a contribution to that?
Go ahead.
Good. I'm very glad this issue of safe school and re-entry of girls has come to the fore. This safe school and re-entry came, I think it's been the step of the past 3 to 4 years. Fortunately, I was part of the national team that began talking about it. So we did it. Then those of us in special education, we had the first meeting in pharmacy. We realized that this is very general, and like the fears some of you have mentioned, it was very general, and we needed to make it suit our children. And so we began a lot of engagement with stakeholders, and then those who sponsored it, especially UNICEF. Fortunately, early this year, they granted us permission and the resources to be able to organize it for special. So the special teachers were part of the general training. After that, we did it for the teachers in the special school early this year. So every teacher in the special school, including non-teaching staff, house mothers, laborers, everybody, we had a whole week of training on safe school. And it was very, very interesting. After the 1 week training for the teachers, we had to sit, but before that, we had to sit to adapt the whole package for the learners in special schools. And so after that, we came up with the training. After the 1 week training for the teachers and the non-teaching staff, we invited, it was a COVID era, but we invited some the prefects of the schools. And so we had for every school about 15 children coming in. It was residential. They came in with their parents. The parents accompanied them. They were also accommodated in the schools. And we had 2 days for them. So I would like to let everybody know that for teachers in the special school, there have been specific training to suit the unique needs of the children on Safe School.
Thank you very much.
And then secondly, we had another one recently on using sports and games for Safe School. And that was also general. But just 3 weeks ago, we went to another one that was designed for special schools. So it's now that we are coming to do it for the teachers in the special school, games and sports for special. Now we're trying to adapt everything, every policy, everything that comes to the needs of the learners in the special school. So yeah, it has been done.
I'm glad to see that there's some small steps being taken to make sure
Yes,
it's more inclusive. But my other question that popped up when Foisty was talking was, she mentioned a lot about accountability, and I just want to know, who can we call on to make sure, especially during this COVID time, that protocols are being kept and met, especially for students with special needs or disabilities?
The question again, I'm not getting.
It's more for Steve, but I guess.
Okay, all right, okay.
I'm
good.
wondering who you could also contribute. Who can we call and hold accountable to make sure that our school settings are not overcrowded and protocols are being met for students?
Thank you, Elizabeth. I think the boss in charge, like the government in collaboration with Ministry of Education and Ghana Education Service. And as I said earlier, they cannot bear the burden alone. We have PTAs in our various schools, parent teachers associations in our various schools. We have philanthropies. We have educational leaders. We have individuals who are able to provide. So I think all these people can come on board to assist, rather than leaving everything onto government. It becomes a huge burden on him. Governments are doing their best, but all of us must come together to help.
Definitely. All of us must come together. And on that note, we're about to exceed time for this program. So I'd like to call on our operations manager, Ruby, to give us the closing remarks. Ruby, please, it's your floor. Is Ruby with us?
Hello, everyone. Good afternoon.
Elizabeth.
Yes.
Elizabeth, sorry, this is a very quick one before the closing remarks.
Go ahead.
With the issue of overcrowding, with the issue of overcrowding, it's really a very serious issue. When we went around during the COVID time, they came back to school, we realized they have furniture, but they don't have space, or they have space, but they don't have furniture. And so what DS came up with is that depending on the school and the district, they can decide whether to run shifts. So now there are schools that are running shifts. They close 12 and others, the next batch comes. Others are not doing, those that are not overcrowded, they are not doing it. But those that are overcrowded, the district can decide to run shifts for them.
Well, so infrastructure has always been an issue in education.
Again?
I said infrastructure has been an issue in education in Ghana. And this is really the time. I remember at the onset of COVID, with the monies that came in, Sefakor mentioned it, the 2 billion. Part of it was supposed to build new hospitals, and I think also some extra classrooms or some extra school facilities. So when schools reopened, they would adhere to distance learning or distance and people being spaced out. But where is that money? Where has it gone? Have we seen the schools? Of course not. But infrastructure has been an issue from day one in Ghana. Schools under children still learning under trees. I think we could all probably sense my frustration, but it's been an issue since who knows how long. And I don't know what we could do as a people to combat that.
Elizabeth, somebody put in the chat box.
Okay.
Yeah, that's Aisha. Thank you for addressing that. Aisha actually is asking about the individualized program. And I just want to touch base on that very quickly. Yes, Aisha, we actually as a country, we don't have the individualized educational plan, which we call IEP or 544 plan. We don't have it being part of implementation in Ghana, which is a huge thing. And if I should listen to everybody, I will say we are all talking about the same thing, that nobody tackled the issue with the mind of people with disabilities or children with disabilities in the beginning. And the reality is you and I have to now take a step. I don't want us to leave this platform like those of the ordinary ones. That's why in my initial introduction, I actually said I want to challenge everyone here to take a step in terms of advocacy. But individualized plan, what it's happening, or what it is, it's a plan or program developed to ensure that a child who has a disability is identified under the law and is attending an elementary or secondary educational institution. And that child must receive the specialized instruction, which is related to what? Services. So something like this, we don't have it. And if we want to really implement, maybe Aisha, in your program, you want to take up IEP program. I manage that program here in the Vermont state. That is what I manage, and there is a curriculum for it. There is a plan, a whole plan for it. Which, if you want to do that, could be a step in your organization. And as you have the plan, then you move along with the plan to Ministry of Education. That could be a step, because in Ghana we are solving it in isolation or in silo, as I said earlier. So maybe, yeah, if you want to really go, I like the fact that you mentioned it in the chat, but that we didn't tackle that, or it didn't come up in the discussion. Yes, it's just because we don't have it. But practically, I personally manage that particular program, and there are a lot of layers into it. And as I said, the system is working here, but you might want to take it to another level of going to the extent of looking for the person who will help you to implement it in your school. Thank you very much.
Thank you for that. Ruby, we'll come back to you.
Sorry, please, I've just put a text chat there. Maybe you should look at it.
I saw it. I'm talking about implementation. I'm actually.
It's been because it's something that we every time we go to a school for monitoring, we look at. But like I said, maybe it is not as elaborate as it is in the US. But IEPs are a requirement for every child, every special child in the school.
Aisha, all the things you are saying are positive, but these are not seen on the ground.
Yeah.
No, this is Regina.
I did a lot of investigation around this, research. I went to schools. I called the headquarters, disability, federation. I did a lot.
And they say they don't do IEP.
The positive aspects you are saying, I think.
No, they don't. They say they don't do IEP because I just went to a school yesterday. I went for monitoring yesterday. They said they don't do IEP.
Is it your district that has acquired special funding for such?
No, there's no funding. IEP, you don't need funding to do IEP.
You just need a psychologist or someone to do the assessment and the test, and then
well, that's why I'm saying that
will follow through.
That's why I'm saying that may not be as elaborate as it is in the US.
No, exactly. That's what I'm saying, that if you want to really achieve that goal, there should be a step individually in organizations. Aisha, as she explained, she has a school. So if she really wants to see this manifest, then she should take another step. I'm not saying we don't have it. We have it, but the implementation, it's good that Regina, your region is functioning. But as Faustina also said, we need to tackle this holistically. So my point is about holistic approach. It's not like how somebody is doing it and we capture it that Ghana is doing it. You understand? We want.
Oh, it's that IEPs are every school you go to, they are there. Maybe, like I said, it may not be like it is there. Because even here, I was looking for a clinical psychologist for some of the schools. I wasn't getting. So even the professionals are not even there for the schools to get. That may be the difference between us and what's happening in the US. But what the teachers or the school is in their hands or they are capable of doing with the IEP, yes, they are doing it. They're sitting with parents, with subject teachers, with other service givers who are around. They sit with them to plan IEPs for the children.
So
this is not just Western region. It's something that IEPs.
Can we transition the conversation to the WhatsApp group in the interest of time, and then just have Ruby close us out? This has been a very interesting and dynamic conversation for all of us. And I hope that we'll transition the conversation to the WhatsApp group that we have. So Ruby, please close us out. And thank you everyone for joining us.
Okay, thank you very much, Ms. Watson. On behalf of GIG, I would like to say thank you to, first of all, our speakers, Dr. Sefako, Mrs. Kofi, and Ms. Blessing, for joining us and then agreeing to do this program with us. And then to everyone who joined us, we would like to say a very big thank you to you. And I believe we've all learned a lot from the various presentations, and we are going to apply them as needed. I would like to use this opportunity to inform all of us that GIG will be embarking on a donation on the 28th of May in Koforidua. We've targeted a few schools that will be donating sanitary pads to in commemoration of the International Menstrual Cycle Day. And we are pleading with you all to help us either in cash or in kind so that we'll make this program a successful one. Thank you once again. And I wish to see all of you in the next masterclass. Have a nice day.
Thank you so much, Ruby. Ruby, please put the donation platforms in the chat section. So if anyone is interested in supporting us as we're partnering with another foundation to donate sanitary pads so girls can go and remain in school, we would greatly appreciate it. Thank you so much. All right, thank everyone. We hope that you will join us for the next edition of the Masterclass series, and have a good rest of your weekend. Bye.
Bye.